Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey. Here when you need us most, now and always. University Hospital. One goal, one passion. Every patient, every time. NJM Insurance Group, serving New Jersey's drivers, homeowners, and business owners for more than 100 years. The New Jersey Education Association. NJPBS, New Jersey's 529 College Savings Plan. The Northward Center. PSE&G, committed to providing safe, reliable energy now and in the future. PNC, grow up great. And by Caldwell University. Promotional support provided by New Jersey Monthly, the magazine of the Garden State, available at newsstands. And by the New Jersey Business and Industry Association.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
I don't care how good you are or how good you think you are, there is always something to learn.
I did do the finale, and guess where my trailer was? A block away from my apartment. It couldn't have been better.
People call me because they feel nobody's paying attention.
Start talking right now.
Such a good question. High five.
Hi, everyone. I'm Steve Adubato, and it is my honor to welcome Mr. Joe Lee, who is the Vice President and General Manager of NJ PBS, which is the public television station, New Jersey public television station in the PBS system. Joe, thank you so much for joining us.
Thank you. It's my pleasure to be here.
Joe, by way of background, let everyone know how you come to NJ PBS with your very extensive media background, both on the air and behind the scenes, leading, if you will.
Yeah, I have pretty much a 30-year history in public media, mostly in radio. Started out as talent. I was an overnight announcer, morning DJ in public radio in Baltimore, Maryland, my hometown. And then moved into managing content as a program director and content manager. And then eventually as general manager, moving to Syracuse, New York, where I ran WAER at Syracuse University. So I've played a role as talent, as content manager, and as organization manager. So I got to understand the complexities of the organizations from multiple standpoints.
Talk about your vision for NJ PBS. And for those who do not know, in July of 2011, the public television station in New Jersey, then named NJTV, created. Our leader, the leader of the WNET group, Neil Shapiro, and a group of other folks decided that we should have public broadcasting. Name changes to NJPBS. But your vision for what NJPBS could and should be, Joe, talk about it, please.
Sure. The aspirational goal is to create an unparalleled public media experience for New Jersey. So what does that mean? As you know, we're sandwiched in between the markets of New York City and Philadelphia. There's PBS coming out of both of those cities. So what does that mean for New Jersey? We could mimic what they do. We don't want to do that. We want to create a public media experience across all platforms that is centered and focused on New Jersey. What does it mean to be in New Jersey? What does it mean to be a part of the state in these communities? How do issues impact and affect us? And so while we'll continue to serve, folks with the great PBS programs that they've come to love, we're going to focus a lot of our local productions and acquisitions on New Jersey-centered content.
Well said. And also, if you want to check out what is going on in New Jersey every night, it's NJ Spotlight News. It's several times, but at 6 o'clock, if you will. Again at 7:30 and later into the evening. Also on the New York side for the region is Metro Focus, produced by our colleagues at WNET and WLIW. But let me try this. In terms of the news business, right? There's other news, and we're not here to be critical of those in commercial broadcasting, but there's a distinct difference between what NJPBS / the nightly news NJ Spotlight News does, and many other, if you will, evening local commercial station broadcasts. What is that difference, Joe, in your view?
Sure. You know, the old adage for commercial TV, and this could be dated, so, but if it bleeds, it leads is not how public media approaches journalism. You know, we're here to hold public officials accountable, get them on record. We're here to explore the issues that impact our communities and our state. You know, we're here to convene and have conversation around issues. And most importantly, you know, the way that I like to approach journalism is a solutions-based journalism approach. So not just reporting at people, but reporting with people, reporting with our communities, and helping them to solve the problems and issues that impact their communities.
So in a lot of ways, Joe, it isn't just what NJ PBS puts on the air. It's also what is going on there. It's not even behind the scenes, but in terms of community engagement and involvement. Give us a couple of examples that makes that real for our audience.
You know, there are opportunities to really engage people with, you know, with the issues that are impacting their community. So a little bit of what I did in Syracuse when the headlines came out that Syracuse was the top ranked or the 10th poorest city in the nation, with the highest concentration of poverty among Blacks and Latinos. You know, we chose as an organization and a news entity to explore that for the better part of a year. So we created a project called project called City Limits, and so it was a multi-platform project that was part convening, having roundtable discussions not only with agencies and newsmakers, but with people who were impacted, exploring all the aspects of how poverty affects our community, and bringing in other community partnerships and leaders and organizations to have these discussions. So public media can really play an important part in community convening, having these big conversations that hopefully lead to some solutions and resolutions. You know, I see us doing that at NJ PBS as well. You know, obviously some of the face-to-face stuff is going to be a while until you know, things are better with COVID, but there are engagements and convenings that we can do virtually, like with what our public with what our parent company is doing with American Cities Rising. So that is bringing leaders together across the nation to talk about the issues that are affecting American cities and how we can look to innovation and what's being done to improve the economics of cities. So, you know, as a place in a community convener, you know, this is a important role that public media plays that we just don't see commercial entities in that space.
Joe, let me ask you this. We've been doing a series, Democracy at a Crossroads, for several years. Let's say well before January 6th, 2021. The role, from your perspective, the role of public media in supporting a healthy, vibrant democracy that is struggling mightily as we speak.
Yeah, you know, as a part of the media landscape, you know very well that there are messages coming out from all over the place in media on all of our platforms, and it can be overwhelming to the American public. Public media has always been a space that people can trust to get the information that they need, synthesize that information, contextualize that information, and know that what they're receiving from us is fact-based journalism and information gathering so that they can make sense of what's happening around them. So avoiding these polarization situations that are happening in opinion-based media, you know, people know that they can trust public media to get the information and make their own decisions based on that information.
Hey, Joe, I know you understand time issues in broadcasting better than most. I got 30 seconds or less. Real quick, diversity in public media, particularly at NJ PBS, the importance of it, please.
Yeah, it's important that we make diversity, equity, and inclusion a foundation of what we do, not only internally, but externally. How our diverse population shows up on our screens and in our content, both in positive ways and meaningful ways. Making sure that people behind the scenes who are making these decisions are from diverse backgrounds and perspectives. So it has to be a part of the foundation of who we're going to be and what we're going to do if we're going to build not only community trust, but expand our audiences.
That is Joe Lee, who is the Vice President General Manager of NJ PBS. I want to thank you for taking the time to talk to us. Wish you and the team at NJ PBS all the best in the important work you're doing. Thank you, Joe.
Thank you for having me on this show. It's a pleasure and an honor.
Same here. I'm Steve Adubato, and more importantly, that is Joe Lee. We'll be back after this.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
Hi, folks. I'm Steve Adubato. We're in beautiful New Providence, New Jersey for the New Jersey Sharing Network 5K. We're honored to once again talk to our friend Chris Bautista. Chris Bautista is the chair of the New Jersey Sharing Network Foundation Board, and your son Luke Bautista, an organ donor and tissue donor. Tell us about Luke. Even though we've talked before, tell us about Luke and why he was such a special young man and the gift of life he gave to so many others.
Well, I like to tell people I didn't know that Luke's name meant bringer of light, but he brought that. Yeah, it does, and I didn't know that until he had passed. But he brought it. He brought it when he was alive, and he's bringing it now, you know, that he's deceased. And he would just light up every single room he walked into. It was a joy. We'd go food shopping. He's like, what's next on the list? And he'd run to other aisles to get it real quick. He'd be on a train and go over and talk to strangers. He was just one of those people that was super engaged with life and everything around him at all times. And he really, I mean, there wasn't a dull moment that we had while he was alive, and now even in his passing.
He was 15.
He was 15 years old. 2016 he passed.
Tell folks what happened.
Well, he was home alone, and you know, he was messing around with huffing, basically, and it went right into his brain stem. He passed out. His older brother, CJ, who was 17 at the time, found him a few minutes later and you know, saw that he was passed out, called 911, performed CPR, passed away a few days later in a hospital, and you know, then we were approached by the New Jersey Sharing Network about donating his organs.
What was your first reaction?
My first reaction, I was at work, it was panic, and I was on the phone with a state trooper who told me to drive as fast as I wanted to on Route 18, and my first reaction was just, I was inconsolable. You know, I remember it was a Thursday night, and I was laying on the waiting room floor, just crying my eyes out, not knowing what to do. Next morning, it was 8:35 a.m. We were told that his brain death test came back and that he wasn't going to be alive, and the Sharing Network approached us, told us about, you know, organ donation and what we could do. Next thing you know, I'm running around passing out these green bracelets, and I had something I could control. You know what I mean? You had that one moment, that one thing you control when everything else is spinning out of control. And we just decided at that point on, my family and I, just to make the best of the absolute worst situation.
Tell folks again, how many people were saved?
Yeah, Luke was able to save 5 people with his organs and improve the lives of 75 others through his tissue donations. You know, with the moment that we were told by a transplant coordinator from the New Jersey Sharing Network that his heart was going to go to a 14-year-old boy in New York, we were just like, you know, and she walked into the room and told us so calmly and didn't want to disturb us because we were still with Luke while he's being kept alive on the ventilator. And I looked at her and I said, the next time you come in with news like that, you better come in through the door and be excited about it, because this is good. We want to hear that kind of positivity right now more than anything. Again, you can't bring him back. You can't bring a loved one back. But if you can make a positive spin on it or take a sad song and make it a little bit better, like the Beatles say, that's what we wanted to do. And so as soon as we had that to grasp onto, I ran with it and got so involved. We raised $86,000 at the first 5K with the Sharing
Hold on,
Network
let's get a couple numbers right.
Yeah.
You raised 86 grand, but you also raised, if I'm not mistaken, over 5 years, over 300 grand?
Yeah.
You're an advocate.
Oh, big time.
Because?
It means so much to so many people. So the first time I came to one of these events, the first person I met. I didn't know at the time. I was standing next to this young man. He was 22 years old. And at that time, he was a 10-year heart recipient. And then it was the first time I met somebody who was alive, or that I knew that had an organ transplant and was alive because of that. And it just became this like overwhelming feeling. I'm like, this is what my son has done for somebody else. This is what, you know, he was able to do in his passing. And that's it really, Luke's mom, Carla, always says it's mind-blowing, and it really is. It's mind-blowing to see someone else who's been saved by someone who's donated organs. And we've had a chance to meet a couple of Luke's recipients as well, yeah.
You got to tell us, what was that like?
Again, overwhelming, but beautiful, and such beautiful people. I will tell you real quick that the two people that we've met, we met Missy, who was Luke's pancreas recipient, and she has diabetes since before she was 10 years old. She had it for 30 years.
She had diabetes?
Diabetes. And
32 years.
She does not have diabetes anymore because of Luke's pancreas. She wakes up every morning now and she reaches over for her, insulin pump.
Right.
And she's like, oh, nope, Luke, I don't need it. So that's the first thing she thinks about in the morning. And it's
that's Missy.
That's Missy. And then we also met Andre. Andre received Luke's left kidney. And the best story I could tell about Andre is that he and his wife, Erica, 4 months after they received, he received Luke's left kidney, they went to the doctor. The doctor gave him the clean bill of health, went home and celebrated. 9 months later, had a baby, Amaya Rose. And we got to meet Amaya. She's like 4 years old now and beautiful, yeah.
Listen, before I let you go and get Team Luke out there and raising more money at this 5K, we're at the 5K, the annual 5K. It's a big event. What would you say to folks about the Sharing Network? Because you're all in now.
Yeah, I'm definitely all in. It's such a beautiful organization. You know, it's a little odd because in some ways I wish I never met anybody here.
Of course.
Because my son would still be alive. But fortunately, I've met some of the most beautiful, just heartwarming, caring, giving people. And it's really made a big difference in my life. You know, I thank Luke because of what he was able to do, because of that opportunity. It's channeled my life into something more positive and fulfilling that I could ever imagine. You know, if I could have him back, that would be my decision, obviously. But, you know, again, we took a sad song and made it a little bit better by doing what we're doing.
It's helped a lot of people.
Yeah.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
We're pleased once again to be joined by David Saccolo, who is Executive Director of the New Jersey Higher Education Student Assistance Authority. Good to see you, David.
Good to see you, Steve.
Okay, we'll put up the website for the authority. Tell everyone what you do and why it matters.
So we're the state agency that helps students and families get the financial resources, the money, as well as the information they need to afford college. And we are all about Governor Murphy's agenda to make college more affordable. Key elements of that is reduce that net cost that students pay after all the grants and scholarships, including the ones that the state provides through HESA, as well as helping them take out less debt in the first place by saving for college over time through our NJPBS program.
Yeah, we're a 529 family on our end, and people Google 529 college saving plan and figure it out yourself if you're able to do that. You know, easier said than done, but it's important. Hey, David, do this for us. The impact of the pandemic as we do this program toward the end of 2021 on higher education overall, but also higher education affordability.
So we have been very important to try to help people because they faced greater costs. Obviously, people had more challenges paying for college with the disruption to employment of various kinds, both people working for a salary and the self-employed or business owners. Those families had difficulty last year in particular as huge amounts of jobs were impacted. Students, of course, also work. And students are working while they're going to college. And look at the kinds of jobs many students do, retail and hospitality. Those are the kinds of jobs that students do while they're going to school, in many cases, those jobs were disrupted. And so our efforts to make college more affordable were even more important. Luckily, there was some federal relief funding specifically for college students, emergency grants, but it's been obviously a very difficult time. We also saw some students withdraw. We definitely saw enrollment declines during the pandemic.
You know, it's so interesting, this whole higher education discussion we've been having with so many college presidents, people in the higher ed community, people on your end, folks who understand financing of investments that are important in our lives, particularly education. Do you think, David, I know in some ways this goes outside of the scope of the authorities' work, but that somehow this pandemic on some level has dampened a significant number of people's view of what higher education is? Or is it, if they really could, they would, and it's just really an affordability question? It's not, it doesn't matter anymore, because I can't, particularly with one son in college, the other one about to go, I can't imagine that.
No, listen, the jobs that were created in the recession, the jobs that held up best during the pandemic, those were the jobs requiring education after high school. And so credentials that are valued by businesses, valued by industries, that you earn after high school in a college setting or in some form of career training, are more important now than ever before. When you look at the jobs that did best, when you look at the jobs that gave people the greatest mobility, it's those that required education after high school. And so college affordability is where it's all about. And the key point is reducing that net cost that people pay. And so we've got a bunch of things we're doing on that.
Name a couple of quick programs, David.
Yeah,
so again, go to the website to find out more yourself. Go ahead, David.
Yeah, so listen, we've added funding to our need-based financial aid grants, the tuition aid grant and the Educational Opportunity Fund, the EOF program. That's helping people pay less total for college because we're helping them pay some of that tuition. We've also created a college promise, which is to give people a predictable net price, a price of $0 to go to community college, no tuition and fees, free, if you have a family income under $65,000. We started that 3 years ago. It's been incredibly successful. More than 50,000 students, almost half of the students at community colleges are benefiting from the Community College Opportunity Grant. And then third, we are expanding that starting in fall of 2022 to pick up the third and fourth years of college for students at a 4-year public institution in New Jersey. They too will now be able to get a Garden State guarantee, free tuition for years 3 and 4 at one of those public 4-year schools if their family incomes are up to $65,000. And if their incomes are above $65,000, there will be a predictable discount off of that sticker price up to a sliding scale where it phases out.
So is it fair to say, as we're running out of time here, David, that many of the programs, if not all of them, are income-based, meaning the need is clearly greater for lower income or families that are struggling on the lower end of the socioeconomic strata, if you will, that those programs are designed more for those folks to give them the opportunity that so many of us who have been so blessed and fortunate and our kids have had? Is that, I know it's overly simplistic.
Well, no, that's a crucial part of it, because making college affordable really is about figuring out how we can get that net price lower. But we also are incentivizing college savings, including with our tax deduction. So families in New Jersey with incomes up to $200,000, under its exciting new law that the governor signed in June, the College Affordability Act, they can deduct up to $10,000 in tuition that they pay. They can deduct up to $10,000 a year that they put into a New Jersey Best 529 college savings plan. We also have a matching grant program for people putting money into a 529.
David, I'm sorry for cutting you off. There's a time issue, right? Oh, as always. We'll have you back. David Saccolo, Executive Director, New Jersey Education Student Assistance Authority. Thank you, David. We appreciate important information.
Appreciate it, Steve. Thank you.
I'm Steve Adubato. That's David Saccolo. We'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, University Hospital, NJM Insurance Group, the New Jersey Education Association, NJPBS, New Jersey's 529 College Savings Plan, the North Ward Center, PSE&G, PNC, Grow Up Great, and by Caldwell University. Promotional support provided by New Jersey Monthly and by the New Jersey Business and Industry Association.
How do you create change? By cultivating hope. And we see that every day. In the eyes of our preschoolers, in the souls of the seniors in our Adult Day program, in the minds of the students at Robert Treat Academy, a national Blue Ribbon School of Excellence, in the passion of children in our Youth Leadership Development Program, in our commitment to connections at the Center for Autism, and in the heart of our community, the North Ward Center, creating opportunities for equity, education, and growth.